We're a dedicated aeromed squadron. Our job is to look after casualties and patients from point of wounding in a conflict zone all the way back to the UK. The training that we're conducting while we're here is actually slightly different to our normal medical training. Most of our squadron members are already clinical professionals who have already deployed in the past. To come to Cyprus to teach them about survival and evasion, resistance and extraction is something they've never ever done before, and it's something that they are thoroughly enjoying, and it's something that we hope they will never need to use, but if they do, they're now trained to be able to do that.
I'm an ITU nurse, so I joined the reserves to get some ITU military medical experience. The difference from military patients and NHS patients in ITU would be the mechanisms of injury generally. ITU patients in the military are generally trauma patients, which is a small percentage in NHS.
Well, I decided to join the Royal Air Force Reserves because I was looking for something different in my life, an extra challenge. I wanted to use my clinical skills but in a different environment, particularly in the air. I wanted to travel but not move house, and I wanted to work with other enthusiastic, like-minded people, but again not change jobs. In 2012 I deployed to Afghanistan to work in the Role 3 in Bastion in the intensive care unit. Compared to my intensive care unit in Bath, it was like a different world. The process and the daily routine was very similar, but once you start looking at your patients and then you look outside the window, you realise you are really in a very, very different environment, and it's probably a career highlight for me and one of the biggest challenges I've ever done.
I think it's perfect training. It gives you that scenario training that this is as close as it's going to get to real life. There's no doubt, certainly being an NHS GP and working in the RAF reserves is difficult. It certainly fills your hours. But if you are the right sort of person and you're keen, the RAF has so much to offer, and the NHS backs you to try and take these sorts of opportunities. It's doable. It's work hard, you have to be enthusiastic, but the benefits pay off.